to Shri Medical College. Today we will explore terminology used in the operating room by physicians and other medical professionals. Lesson 02. Echocardiogram, a test that uses ultrasound waves to make a picture of your heart and see how it moves. Enhanced recovery, the name of a program that tries to get people back to normal health as soon as possible after a major surgery. The staff at the hospital looks at all the evidence about what they and the patients can do before, during, and after surgery to help the patient get better. Endotracheal tube. During an anaesthetic, a small plastic tube may be put into your windpipe, trachea. This gives your lungs oxygen and gas to make you sleepy. Epidural, a local anaesthetic that is put in your back. A very thin tube called an epidural catheter is put in your back with the help of a needle. Catheter-administered local anesthetic relieves discomfort. This top-up can last hours or days. This relieves abdominal or pelvic discomfort during labor or after surgery. Family history, information about your health and the health of your family. Fasting, before a surgery or procedure, there are certain times when you shouldn't eat or drink. Full blood count, a test that counts every single cell in your blood, platelets, red blood cells, and white blood cells. Gas, drugs that make you sleepy that you breathe in. Gastric tube, nasogastric tube, the tube is soft and goes into your stomach through your nose. This can make your stomach lose water. It can take liquids, foods, or medicines to your stomach. Group and save, a sample of your blood to find out your blood group in case you need a blood transfusion. It also checks to see if you have any other antibodies that need to be matched to make sure you don't have an allergic reaction to the blood you are given. Guidal airway, when you are out of your mind, a curved piece of plastic is put in your mouth. This keeps your tongue from getting in the way of your airway, which makes it easier to breathe. Hemorrhage, bleeding. High dependency unit. 2. A ward for patient requiring higher levels of monitoring, treatment, and nursing care than may be provided in a standard ward but less than those provided in critical care. Hypertension, unhealthy levels of blood pressure. Hypoglycemia, high level of sugar in the blood. Hypotension, reduced blood pressure. Hypoglycemia, hypo, low sugar levels in the blood. Identity bracelet, a bracelet made of flexible plastic that displays your name, birth date, and hospital number. This bracelet can be worn on either the wrist or the ankle. They will look at your wristband to make sure that all of your medical details are accurate before administering any medications or treatment to you. Inpatient, a person receiving medical care during an extended hospital stay. ICU, or a 2, intensive care unit, specialized hospital ward for the treatment and close observation of critically ill patients. Intravenous drip, or infusion, intravenous fluids given through a cannula. There is a chance that these contain medication. Intubation, when you're under anesthesia, a tube is inserted into your trachea to make it easier for oxygen and sedative gas to reach your lungs. Labor ward, hospital section where women go to give birth. Laparoscopy, keyhole surgery, this cutting-edge method of surgery makes it possible for the surgeon to see and work inside the patient's abdomen and pelvis with tiny equipment. When this happens, the damage to your skin is minimal, and you heal faster. Laryngeal mask airway, LMA, it's a piece of machinery used in anesthesia. Without inserting an endotracheal tube into the trachea, oxygen and anesthetic gas can easily reach the lungs. Laryngoscope, the anesthesiologist will need lighted equipment to examine your larynx, voice box, before inserting an endotracheal tube. Mask, devices that cover the face, typically composed of transparent soft plastic. Before your anesthetic or after you wake up in the recovery area, the anesthesiologist can give you supplemental oxygen to help you breathe. Mobilize, to rise and walk about the room. Muscle relaxant. Muscular relaxants are medications that work by inhibiting nerve signals, so reducing muscle spasms. Nausea, it's an unpleasant feeling that originates in the stomach and is also known as nausea or a stomach ache. It's a common symptom of being nauseated. Neonatal Intensive Care Unit, NICU, specialty hospital unit that caters to the needs of seriously unwell infants and monitors them around the clock. Nasotracheal tube, as oral surgery is being performed, the endotracheal tube is used to provide the patient with oxygen and the anesthetic gas. Surgeons can access the mouth more readily by inserting this little plastic tube through the nose instead of the mouth. Operating Department Practitioner, ODP, a highly trained employee who assists surgeons during procedures. Esophagus, gullet, food passes via a tube as it travels from the back of your mouth to your stomach. Outpatient, a patient who visits the hospital for a specialty appointment, treatment, or testing but returns home afterwards. Pediatric, a young person, usually under the age of 16. Palpitations, the perception that your heart has slowed down or beat more quickly. Your heart can feel like it is fluttering, thumping, or racing. Patient-controlled analgesia, PCA, pump, a painkiller pump with computerized controls that dispenses medication intravenously at the touch of a button, helpful in determining the appropriate amount. Peribulbar block, regional ocular anesthetic blocks are used to numb the eye before surgery. Peripheral nerve, the nerve outside of the brain and spinal cord. Pre-operative care, describes the process of taking care of a patient from the time they first consider surgery until they have fully recovered. To do this, a large team of healthcare specialists from many fields would collaborate, always putting the patient's needs first. Platelets, clotting factors, are tiny cellular components found in your blood. Post-operative nausea and vomiting, PON. Post-operative refers to the time period following surgery. Join Shri Medical College's Bachelor of Vocation in Operation Threat Technology and take the first step toward a successful career in operation technologist. We are here to assist you in launching your career as an operation technologist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Medical College. Good luck, goodbye.